Have you ever had a feeling that something was off, but it was so subtle, so ordinary, that you shrugged it off? Maybe it was a little extra bloating after lunch, a strange pressure in your lower belly, or the kind of exhaustion that lingered no matter how much you rested. These little things are easy to ignore. We blame stress, hormones, or a busy schedule. But what if those everyday annoyances were actually your body's quiet cry for help? Ovarian cancer doesn't always make a grand entrance. It's not a disease that slams you with sudden, unmistakable symptoms. Instead, it creeps in, silent, slow, and often unnoticed. It hides behind symptoms that seem harmless at first. And that's exactly what makes it so dangerous. Every year, more than 300,000 women are diagnosed worldwide, and sadly, the majority are already in advanced stages by the time it's detected. Why? Because the warning signs were either missed, misunderstood, or brushed aside. But imagine if you could recognize the signs early, before the cancer spreads, while it's still treatable. What if just paying closer attention could change the outcome for you or someone you love? That's why this video matters. Today, we're going to walk you through 12 crucial early symptoms of ovarian cancer that research shows often show up before diagnosis, but too often go unnoticed. These symptoms are not random. They are patterns your body wants you to pay attention to. Some are subtle. Some are surprising. And one of them, most doctors don't even talk about, but it shows up in thousands of real cases. So don't look away. Stay with us until the end. Because what you learn today could be the most important health lesson of your life, or the life of someone you care about. Symptom 1: Unusual vaginal discharge. Let's begin with an often overlooked symptom that many women never associate with ovarian cancer: unusual vaginal discharge. It's easy to ignore, but this change might be your body's first signal that something serious is happening. It's easy to overlook changes in vaginal discharge, especially if they seem minor. But when that discharge becomes unusual, persistent, watery, bloody, or foul-smelling, it might be your body signaling something more serious like ovarian cancer. While not the most common symptom, certain types of ovarian cancer, particularly stromal or germ cell tumors, can cause such discharge. These tumors may produce hormones or disrupt nearby tissues, leading to abnormal secretions. An article published in the Centers for Disease Control and Prevention highlighted this connection. Researchers found that women with early-stage ovarian cancer reported persistent vaginal discharge as their only noticeable symptom. This finding underscores the importance of paying attention to even subtle changes in your body. If you notice any unusual discharge that doesn't resolve or seems out of the ordinary for you, it's crucial to consult a healthcare professional. Early detection of ovarian cancer can significantly improve treatment outcomes. Symptom 2: Pain in legs or thighs. Now, let's highlight a symptom that often flies under the radar but could be one of the earliest red flags: persistent pain in the legs or thighs. While most people wouldn't associate leg discomfort with ovarian cancer, for some women, this deep, nagging pain may actually be the body's first warning sign. This kind of pain is often misdiagnosed as a common muscle strain, nerve compression, or sciatica. It tends to feel like a dull, persistent ache or an intense cramp, sometimes radiating from the lower pelvis down into one or both thighs. The underlying cause? As ovarian tumors grow, they can press against nerves or blood vessels in the pelvic region. This compression can interfere with circulation and irritate nerve pathways, leading to chronic leg pain that doesn't improve with typical treatments. One powerful case study, published in the American Journal of Case Reports in 2024, tells the story of a 31-year-old woman who endured sacral pain and tingling in her right leg for 2 years. Initially, her symptoms were dismissed as musculoskeletal, and she was treated accordingly, with no relief. It wasn't until imaging revealed a large mucinous ovarian tumor spreading into the sacrococcygeal area that the real diagnosis came to light. After surgical removal of the mass, her symptoms disappeared completely. This case illustrates a critical reality: ovarian cancer doesn't always present the way we expect. When unexplained leg pain persists and doesn't respond to standard treatment, it's important to consider deeper causes, including ovarian cancer, as part of the diagnostic process. Your legs might be telling you more than you think. Symptom 3: nausea and vomiting. Now, let's highlight a symptom often misdiagnosed as simple digestion problems: nausea and vomiting. Some women are caught off guard by a symptom they'd never connect to ovarian cancer: nausea and vomiting. It feels like a stomach bug, food poisoning, or just poor digestion. But when it lingers for days or keeps returning without any clear cause, it deserves attention. The reason? As ovarian tumors grow, they can press against the stomach or intestines, slowing down digestion or even blocking parts of the bowel. This can trigger chronic nausea and sudden vomiting, especially in later stages of the disease. A 2022 study published in Gynecologic Oncology followed over 1,100 ovarian cancer patients, and found that nearly 36% reported nausea or vomiting during the diagnostic period, often misattributed to common GI issues. What makes this even more concerning is that many of these women delayed seeking help, thinking it was dietary or stress-related. The study emphasized the need for awareness, especially in postmenopausal women, as delayed recognition significantly affects outcomes. So, if nausea or vomiting shows up with no obvious reason and keeps coming back, don't ignore it. Symptom 4: swollen abdomen with fluid. Let's take a closer look at a symptom that often shows up in the mirror before anywhere else: abdominal swelling caused by fluid retention. You may glance at your reflection one day and wonder why your belly appears fuller, even though your weight hasn't changed. Your jeans feel tighter around the waist. But this isn't about gaining fat, it's about fluid buildup. In ovarian cancer, this condition is known as ascites. It occurs when cancer cells irritate the lining of the abdomen, prompting the body to release fluid into the surrounding space. Over time, this accumulation doesn't just alter your appearance, it can also make breathing difficult, reduce your appetite, and create discomfort during even the simplest movements. This isn't just an aesthetic concern, it's a physical warning sign. In fact, doctors often point to persistent abdominal swelling as a red flag that should not be ignored, especially if the bloating recurs or worsens over time. According to a 2015 study published in Nature Reviews Cancer, women newly diagnosed with epithelial ovarian cancer frequently presented with moderate to severe ascites. The research clearly linked the presence of abdominal fluid with more advanced disease and poorer outcomes, underscoring the urgency of early detection. So if you or someone you care about is experiencing unexplained, persistent abdominal bloating, especially when accompanied by discomfort or difficulty eating, don't wait. Ask your doctor about a pelvic ultrasound or further imaging. It could be the step that changes everything. Symptom 5: indigestion or heartburn. Let's turn our attention to a digestive issue that may seem harmless but could be telling a different story: indigestion or heartburn. That burning sensation after meals or the bloated feeling that just won't go away. Many of us chalk it up to something we ate or stress. But when indigestion or heartburn becomes a regular part of your day, it's worth paying closer attention. In some cases, These seemingly minor digestive issues can be early signs of ovarian cancer. Recent research from the UK collaborative trial of ovarian cancer screening highlighted that gastrointestinal symptoms, including indigestion and heartburn, were reported by 35% of women with early-stage high-grade serous ovarian cancer. Interestingly, these symptoms were more prevalent than the traditionally recognized gynecological signs like vaginal bleeding. This suggests that our digestive discomfort might be telling us more than we realize. The study emphasizes the importance of not dismissing persistent digestive issues, especially in postmenopausal women. If you're experiencing ongoing indigestion or heartburn that doesn't respond to usual treatments, it's essential to consult with a healthcare professional. Symptom 6. Menstrual irregularities. Let's take a moment to talk about something many women experience but few connect to serious illness: changes in their menstrual cycle. Irregular menstruation may seem like a small inconvenience, but it can be a powerful sign that something deeper is going on beneath the surface. If your periods suddenly start arriving closer together, last longer than usual, or come with unusually heavy bleeding, don't brush it off. These shifts in your cycle may be your body's early warning system, signaling that something isn't quite right hormonally. And when it comes to ovarian cancer, these warnings can be especially significant. In fact, a groundbreaking study published in the International Journal of Cancer followed more than 15,000 women over the course of 5 decades. The results were eye-opening. Women who experienced irregular menstrual cycles were found to have twice the risk of developing ovarian cancer by age 70, and by the time they reached 77, that risk nearly tripled. This research goes against long-standing assumptions that fewer periods might reduce cancer risk due to less frequent ovulation. Instead, it reveals that underlying hormonal imbalances, like those that cause irregular cycles, may actually contribute to cancer development. So if your cycle has become unpredictable and the changes persist, don't ignore it. Speak to your healthcare provider. Early awareness and timely investigation could make all the difference. Symptom 7. Pain during intercourse. Let's talk about an intimate and often uncomfortable topic: pain during intercourse. That could be far more than just hormonal changes or aging. Imagine feeling discomfort every time you're intimate and being told it's just hormonal or part of aging. That's what many women go through without realizing something deeper could be happening. One overlooked warning sign of ovarian cancer is pain during sex. It's not just emotional or surface-level pain. It often feels like a deep, sharp ache inside the pelvis. Why does this happen? As tumors grow on or around the ovaries, they can press on nearby tissues, nerves, and muscles involved in sexual activity. This pressure creates inflammation and tenderness that make intimacy uncomfortable, even unbearable. A study published in American Family Physician 2021 highlighted that dyspareunia was significantly more frequent in women diagnosed with early-stage epithelial ovarian cancer, often months before diagnosis. The study emphasized how delays in recognizing this symptom led to missed early detection opportunities. Sadly, many women downplay this pain, thinking it's just part of menopause or stress. If intimacy feels physically wrong, listen to your body. Don't brush it off. Early detection can save lives, and talking to your doctor could change everything. Symptom 8. Fatigue. Now let's turn to a symptom that often slips under the radar because it feels so familiar: exhaustion that just won't go away. If you've been waking up feeling like you barely slept, or dragging yourself through the day no matter how much rest you get, don't be too quick to chalk it up to a busy lifestyle. This kind of unrelenting fatigue might be more than everyday stress. It could be your body signaling something much more serious. For many women, persistent fatigue is one of the earliest but most overlooked warning signs of ovarian cancer. Unlike normal tiredness that fades with rest, this fatigue lingers, weighs down your energy levels from morning to night, and slowly chips away at your quality of life. A revealing study published in the Oncology Nursing Forum examined 233 women undergoing chemotherapy for gynecologic cancers, including ovarian cancer. The researchers found clear patterns of persistent fatigue throughout the day. More than half of the women reported feeling either high or very high levels of exhaustion both in the morning and again in the evening. Interestingly, this fatigue wasn't just physical, it was connected to other factors too. Women who experienced more severe fatigue tended to have higher body mass index, greater anxiety, and symptoms of depression. Their sleep, mental focus, and daily functioning were all affected. So if you've been feeling unusually worn out for weeks with no obvious explanation, it's time to stop brushing it off. Persistent fatigue may be your body's quiet way of saying something isn't right. Paying attention could lead to earlier answers, and potentially, life-saving action. Symptom 9. Frequent urination or urgency. Now let's examine a daily disruption that may be more than just a bladder issue: frequent urination or urgency without clear cause. Frequent urination might seem like a minor inconvenience, perhaps just a sign of drinking too much water or a mild bladder issue. However, when this symptom appears suddenly and persists without an obvious cause, it could be an early indicator of ovarian cancer. The ovaries are located near the bladder, and as a tumor grows, it can exert pressure on the bladder, leading to increased urinary frequency and urgency. This pressure reduces the bladder's capacity to hold urine, causing you to feel the need to urinate more often, even if the bladder isn't full. A study published in the Journal of the American Medical Association found that 55% of women with ovarian cancer reported urinary symptoms, including frequency and urgency, compared to 32% of women presenting to primary care clinics without ovarian cancer. This significant difference highlights the importance of recognizing urinary changes as potential early signs of ovarian cancer. If you're experiencing persistent changes in your urinary habits, it's essential to consult with a healthcare professional. Early detection of ovarian cancer can significantly improve treatment outcomes. Symptom 10. Feeling full quickly. Now let's shift our attention to a symptom that might show up during your meals: feeling full unusually quickly. Have you ever sat down for a meal only to feel completely stuffed after just a few bites, even though you barely ate all day? It might seem like a harmless quirk or a one-off experience, but this condition, known as early satiety, can be an important warning sign. In cases of ovarian cancer, tumors can develop in the pelvic region and begin pressing against the stomach and nearby organs. This pressure reduces the stomach's ability to expand and accommodate food, which leads to that abrupt feeling of fullness. In some patients, the situation becomes worse with the buildup of abdominal fluid, a condition called ascites, which increases pressure inside the abdomen and intensifies the sensation. A 2024 study published in the Indonesian Journal of Cancer revealed that early satiety was among the most frequently reported symptoms in women with advanced stage ovarian cancer. Researchers noted that it often coexisted with other complaints like persistent bloating and abdominal discomfort, appearing well before an official diagnosis was made. If you notice that you're regularly feeling overly full after eating very little, especially if it happens alongside bloating or unusual discomfort, it's more than just a digestive quirk. It may be your body's way of alerting you to something serious. Don't wait. Talk to your doctor. Detecting ovarian cancer early dramatically improves the chances of successful treatment. Symptom 11. Pelvic or abdominal pain. Now, let's talk about pain that lingers in the lower belly, a quiet signal that should never be ignored. You know your body better than anyone. So, when a strange nagging ache shows up in your lower belly or pelvis and it doesn't go away, it's worth paying attention. This kind of pain can feel like a dull cramp, a pulling sensation, or even a sharp jab. Many women brush it off, blaming digestion or their menstrual cycle. But when that pain lingers for weeks, it might be something more serious. In ovarian cancer, this pain often comes from tumors pressing on nearby tissues or organs. As the cancer grows, it can stretch the lining of the abdomen or invade nerves, triggering discomfort. According to a 2023 study published in JAMA Oncology, over 63% of early-stage ovarian cancer patients reported pelvic or abdominal pain as their first noticeable symptom, often weeks before diagnosis. The tricky part: this pain doesn't always feel intense. It might come and go, but the pattern is the clue. If it's new for you, happens more than 12 days a month, and keeps returning, don't ignore it. Getting it checked early could make all the difference. Symptom 12: persistent bloating. Finally, let's return to one of the most common and widely ignored signs: persistent bloating that just won't go away. That bloated, stretched feeling in your belly that just won't go away. It's more than just discomfort. It could be your body's way of signaling something serious. Ovarian cancer often manifests subtly, and persistent bloating is one of its early signs. In a study published in the Journal of Gynecologic Oncology 2023, researchers found that persistent abdominal bloating or distension is the symptom most commonly associated with ovarian cancer. This finding underscores the importance of recognizing bloating as a key symptom of this disease. If you're experiencing bloating that persists for more than 2 weeks, especially if it's accompanied by other symptoms like pelvic pain or changes in appetite, it's crucial to consult a healthcare professional. Early detection of ovarian cancer significantly improves treatment outcomes. You've just learned 12 of the most overlooked, but potentially life-saving, symptoms of ovarian cancer. These signs may appear subtle, but they carry weight. They are your body's early warnings, quiet messages that something deeper may be happening beneath the surface. You've just taken a powerful step, one that could protect your health or even save a life. Awareness is the first line of defense, and knowing these 12 symptoms means you're no longer in the dark. But this knowledge isn't something to keep to yourself. Share it. Talk about it. Because the more we speak up, the more lives we can change. If any of the signs we discussed today felt familiar, don't wait. Trust your instincts. Talk to your doctor. Early detection of ovarian cancer can dramatically improve outcomes, but it starts with listening to your body and acting on what it's trying to tell you. If you found this video helpful, inspiring, or eye-opening, don't forget to hit that subscribe button and turn on the notification bell. At Healthy Care, we're committed to bringing you life-changing information that empowers you to take control of your health, one decision at a time. Thank you for watching, thank you for caring, and remember, you're not alone on this journey. Stay strong, stay informed, and we'll see you in the next video.